I am Teja Balantrapu. I'm the Communications Manager for the International Agency for the Prevention of Blindness. We are doing a small webinar on nurses and them being an untapped resource. And to help us do this webinar is Heather Machin with us. Heather is a registered nurse, and she's also a project officer with the Centre for Eye Research Australia, an IAPB member. She also works for a number of other organizations. I think she also works for Fred Hollow's New Zealand. And yeah, she has helped us put together some fantastic resources on the IAPB website, especially around iBanking. I think she plays a key role in the iBanking consortium as well, and on corneal donations. So Heather, thank you again for your time and for helping us do this webinar. And please take it from here.
Fantastic. Thank you very much for that introduction. And hello to everybody who's joined us. I can't see who's joined us, but I do know from the RSVP list, we had people from Canada, the Cameroon, the Philippines, Barbados, Peru, and all the way down here in the Pacific Islands as well. So hello, Fiji and New Zealand. We also had interest, there may be nurses on the line, but we may also have some program managers and also some ophthalmologists or even orthoptists. So welcome to all of you. Even though you may not be a nurse, I'm hoping that you'll be able to get something out of this session. So the session today is going to be in English. If I am speaking too fast, you can click on the chat button on the GoToMeeting and let us know, but I'll try and talk as clearly as possible for you. At the end of the session today, there'll be, well, actually after the session ends, you'll be sent an evaluation form. If you could fill that in, that would be really, really wonderful. So hopefully by now you can see my screen. So we might get going. We have more people on the line. So as I've already been introduced, so I am Heather. So I work in both iBanking and ophthalmic nursing. I have been involved as both a staff nurse, a nurse educator, and then the manager of a team, and then the manager of a facility providing ophthalmic care as well as other day surgery stuff like IVF or dental and endoscopy. So I have a wide range of backgrounds, but today I'm just going to be presenting as a nurse. So it is International Nurses Day. Congratulations to all the nurses. It's celebrated on Saturday, the 12th, which is Florence Nightingale's birthday. Every year there is a theme. This year, the International Nursing Council, their theme was Health is a Human Right, Access, Investment and Economic Growth. Now, I'm not going to talk today about human rights because I'm pretty sure that most of us involved in healthcare are here because we believe that health is a human right. But what we're going to talk about today instead is what we can do as nurses or ophthalmologists or program managers in using nurses a little bit more to actually make health accessible to even more people. So I'm going to start by looking at the team. Today, in our team, we sort of split it into three categories. We have an ophthalmologist, an optometrist, and then we have everybody else in one category called allied ophthalmic health care providers. Now, this categorization is convenient and it allows skills to be transferred between those within that group of allied healthcare professionals. This approach to the team has been very, very successful in terms of a vertical planning whereby we've approached different diseases such as cataracts or pediatric blindness and those sorts of things. Unfortunately, when we start to move towards a horizontal plan, which is where the WHO is going, where we need to look at teams, I'm not so sure that this model still works, and you may disagree with me. By putting everybody else into one category and then separating two, to me it just doesn't feel right. So I'm a nurse, and I've been shoved in with another group of people who are also incredibly good professionals. They're highly qualified and in their own right. But putting us all together, I kind of feel it's slightly disempowering. It doesn't really make me empowered or make me feel like I'm actually of any value, even though I know I actually am. So what I'd like to see is I'd like to see us pulled out from within the allied ophthalmic team, even though the convenience of calling us an allied health team is something I do understand. I want to be pulled out so that I can actually be on the same page as everybody else. And maybe in this model, this is the way to go. Or is it? Well, perhaps that's not fair to everybody else. And as we move towards horizontal planning, maybe we need to actually readdress the entire team to the team of the future, where we're actually all involved in the care of the patient, all involved as active members in building our facilities. We're all part of the same team, but we're all recognised for our differences, and we use those differences to our strengths in a unique and professional way. So this is where I'd like to see us go, and I hope you'll join me on this quest. I've put a resource at the top of the page there, Mortison's 2018 paper on rethinking teams and the boundaries of teams. We each involved in this team and that team, but all together, we're all in the same team. So have a read of that paper if you get a chance. Now I'm going to have a look at nursing and actually discuss what nurses are and how we can, as a community, work forward. There's some stereotypes that we need to address. So first of all, we have the lady with the lamp, Florence Nightingale, military-based nursing. We have the old-fashioned version of nurses as handmaidens, standing there passing instruments, or as cantankerous old battle axes. We also have the sexualized version of what a nurse is or isn't. And then we have this imagery of nurses and doctors battling it out. These stereotypes are not helpful at all, and they don't actually describe what nurses are and what we do. And unfortunately, these stereotypes are part of the problem in ensuring that nurses are part of the voice for the future of ophthalmology. So as nurses, we are members of the eye care team, but what we also are is we're members of other teams, and we are continually interacting with a wide range of teams, and these teams are also interacting with each other. So while I am a member of an eye care team, I'm also a member of a workplace health and safety team. I may also be on the executive, because nurses in some countries are also CEOs, as well as directors of clinical service. I may also be involved in ambulatory surgery care, perhaps today working with ophthalmic patients, but tomorrow I might be working with endoscopy patients, who knows. The point being, our teams are all interacting. So regardless of whether we're working different teams in eye care or working in different teams in nursing, they are all intertwined, and we need to recognise this and also recognise the beauty that comes with this immense amount of skill. There's also a move at the moment within ophthalmic practice and in nursing in general to move towards extended practice. You may hear the terms advanced nurse practitioner or clinical nurse specialist, or extended practitioner or nurse prescriber. These are all they all come and go depending on what country you work in or where you were trained. And there are a lot of things going on. Some nurses in high resource countries are involved with intravitreal injections, subtenon blocks for preoperative patients who need their eye prepared for surgery. Some are prescribing medications, and there are also some doing minor procedures. In the Pacific Islands, nurses are involved in prescribing spectacles as well as medications. As a nurse from the outside, I look at this and think, wow, this is amazing. These nurses are doing fantastic things and I should be involved. But I want to just put a little bit of caution before this. It's great that nurses are involved in a wide range of things. But just because one country or one nurse is doing something doesn't necessarily mean that you should. The whole point of extended practice is to use the skills that we have to enhance the services. The only reason nurses in these countries are doing these skills is because there is a gap in the service. They've had a look at what the needs are of their community, and they've based the needs to get nurses to do more to fill those gaps. So if you are in a country where it's agreed that nurses should be involved, then certainly look at this. But I wouldn't advocate the perception that we should be doing this. Look carefully at the demographics of the patient needs first, and what can be done. In certain instances, maybe other healthcare providers can be involved, like the orthoptists or the optometrists. So work together with a team before determining whether extended practice is right for your country. There are a great many benefits of involving nurses in programs. See, the thing is nurses know facilities. We know our hospitals, we know our day surgeries, we know our clinics. Our ophthalmologists, we love them, but they come and go. They do a few years and then they're off to their next place, or maybe they're just coming in and doing their list and then they go to their next hospital. Nurses are there for an entire shift. We're there before the ophthalmologists get there, we're there after. So we know everything about that facility. The interesting thing about nurses is patients actually tell us stuff that they don't tell the ophthalmologists or the managers. And it's not unusual that nurses are actually being asked to answer questions for the patients. Unfortunately, some patients are afraid to ask the ophthalmologist a question. So we can be incredibly valuable in looping the ophthalmologist with the patient in those particular instances. We're also multitaskers, so we can work in a wide range of areas within one specialty. It makes us an incredibly useful tool in the eye healthcare team. Nurses are also incredibly important in governance or policy development. Here in Australia, in the hospital day surgery that I ran, I was in charge of all of the governance, from HR to workplace health and safety, to anything. It's a never-ending job, but it's incredibly important. Sometimes we look at governance and policy as being incredibly boring, but it's incredibly necessary, and nurses need to be involved. In this particular example I have on the screen, I worked with a group of nurses across the Pacific from lower resource and high resource countries to develop a suite of policies and frameworks to help guide practice. This has been an amazing opportunity, and we developed over 100 resource tools for the Pacific. The idea was also to take the hospitals out of silos so that one hospital could borrow the material and adapt it slightly for their hospital without having to reinvent the wheel. This is an amazing accomplishment. Unfortunately, however, as is often the case with policies, once the policy is written, it's ticked off, and then they get put into a shelf, or they get put into a computer file and nobody ever looks at them. These are the bad things that can happen with policy, and we need to reiterate that policies are not there just to be ticked off as having been written. They have to be embedded into the actual practice. So policies, for example, if you're a nurse on the phone listening to this call today, because I don't know where you're all from, but if you are a nurse, you need to ask if you have policies or procedures or work instructions at your facility. If there are, you need to have access to them. They need to be in your work area, perhaps in a folder, or available on a computer in a central area in your ward, and they need to be regularly updated, and it's your responsibility to read them and be proficient with those materials. Now, the Fred Hollis Foundation, we do have these materials available, and if you would like a copy, I'd be more than happy to send them to you. And that's not a problem at all. And I also like to acknowledge, I think we have Stephanie Long on the call today. Stephanie Long is the governance and quality nurse at the Fred Hollis Foundation New Zealand, who has the wonderful job of working with the nurses in the Pacific to roll out these policies across the Pacific. So it's a long-term job. Just writing, ticking them off isn't enough. You have to have a quality nurse involved to actually get the material out there and get them as part of routine practice. So I'm taking my hats off to you today, Stephanie. So I want to look at when nurses aren't utilised, and this is something that I've felt. See, the thing is, I work in Australia, so I'm a nurse in Australia, and Australia is what's called an egalitarian community. So when I'm working with my boss or my CEO, I'm allowed to share my opinions and share my opportunities. So when I'm working in Australia, I have a really lovely life as a nurse. I get the opportunity to be involved actively, and I'm incredibly grateful for that. Unfortunately, however, as I've travelled around the world, I've realised that that's not always the case. Perhaps that is my culture, perhaps that's me personally. But I did find myself at one stage burnt out and incredibly frustrated because as a nurse, I wasn't involved. I wasn't allowed to be involved. Now, there's a few different things that can happen when nurses aren't involved. Some of them just tune out. They just come to work, do their job, go home. They won't get involved actively. They won't share their opinion, and they actually become quite destructive. There's also another group that will just leave the profession or leave the sector, and they won't get involved either. And then there's a third group, which I am, which is we get louder, we get bossier, and we shout. And that's not good for us either. It's not good for anybody. So utilising nurses is incredibly important, and if we don't, we hurt ourselves, we hurt our sector, and we're not really advancing. So we really need to work at including nurses in any of our programs. So I want to do a call to action now to the program managers or the ophthalmologists involved on the call. And I want to actually congratulate them for the vertical planning that they've done to date, the amazing programs that they've developed all around the world for ophthalmologists and optometrists, and the incredible infrastructure they've built in many countries, and the amount of support they've done to blindness issues. It's been an amazing period, and now I'd like to start the next chapter. I would really love to see nurses involved a lot more in program development. I would love to see program managers, including nurses as nurse consultants, whether that's for general items or even to develop nurse training programs. It's not uncommon when I'm reading the news in the sector that there are training programs or NGOs or other groups that are developing programs for nurses. But when I look into the detail, generally there's never any nurses involved in those development programs. And a good indication of whether or not a program is actually working is whether there are actually nurse leaders. And while there are a lot of training programs out there right now for ophthalmic nurses, I see very, very few ophthalmic nurses taking to the podiums at conferences, sharing research, and being an actively involved voice in the international community. So that's an indication to me that while we might be training them with BASE, we're actually not letting them be leaders. So we're actually not empowering them in the way that we think we are. We need to do something about that. So I'd like to welcome all of the non-nurses on the team to help pioneer for a new era in our interaction with nurses. I would love you to start championing and supporting nurses and nurse management, both in the facilities that you work in, but also within your own NGO organisations. If you don't have a nurse consultant, find one. If you don't know one, email me and I'll try and find one locally. You also need to be abreast with some of the historical and hierarchical issues of the healthcare system in order to put something in place to prevent it from happening in the future. So, for example, the nurse-doctor conflict has been around for centuries. Well, maybe not centuries. But if you don't understand the history behind that, you can't do anything to prevent it in the future. So please absolutely become familiar with mitigating conflict within a healthcare team. In doing so, I also ask you to invite other members of the team to the table: nurses, orthoptists, optometrists, medical photographers. It's really important to listen to all groups. And I have a call to action for nurses on the call. We are incredible healthcare providers. We are people-centric. We care about the patient. We're not the group that sits there looking down the microscope at cells or looking specifically at a disease. We're the group that looks at the patient in a holistic way. We care about and think about how they're going to function when they go home, how this treatment or lack of treatment impacts their family. We are the holistic carers. We have an incredibly high tolerance to stress, and we're also incredibly versatile. We have done amazing work in the past, not just in ophthalmics, but in a wide range of different nursing sectors. But we too need to start a new chapter. Some of the biggest barriers, and this might be just my opinion, and I'd love to hear about your opinion and your evaluations, but I think one of the biggest barriers to nursing is ourselves. We blame the ophthalmologists or other doctors and other healthcare professionals a lot, but in a way it's also ourselves. We don't get involved and we don't support each other. We have an incredibly bad bullying culture within our own profession. Maybe that's a Western problem, I'm not sure, but within the Western nursing healthcare culture, we eat our young, we don't celebrate each other, and we do everything we can to prevent each other from doing well. But there comes a point when we as nurses have to stop doing that and take professional responsibility for ourselves. It's the only way that we can actually do anything and work forward in a collaborative, professional manner. We have also got, even though I've mentioned the outdated hierarchical problems within the healthcare team, such as nurses and doctors and so forth, even in our own nursing discipline, we have hierarchical nursing issues. It's not uncommon for me to go to some countries and I'll find an incredibly talented young nurse, but she's not allowed to excel because of her age, or even worse, because of her ethnicity. Nursing is also, particularly in most of the world, a female-dominated profession. And so we also have some gender bias going on as well. So we need to get rid of gender bias, ethnicity issues, and also age issues in nursing, and actually start promoting nurses based on their abilities. So I'd like you to start a new chapter. Start being involved in international development. There is a heck of a lot going on in international development that most ophthalmic nurses don't actually know about, whether it's understanding the WHO's directions or the actions of the International Agency for the Prevention of Blindness, or even understanding your own local national healthcare plan. We need to know about these things. So I need you to work together. Take responsibility for your profession and help take your profession to the next level. As I have just mentioned, please try and get involved in anything that's happening. Know your region. And there's something called the IAPB Vision Atlas, and I'm going to show you that at the end of the presentation. It's your responsibility, not just your managers, which we sometimes think it is, but it's also your responsibility to be professionally up to date with what you need to do to make your work safe for the patient and safe for those around you. You need to read some more. Get involved, find out about some of the free resources out there, the IAPB, the Community Eye Health Journal. And again, I've got the lists at the end of the presentation. Seek to get involved a little bit more. Ask your manager how you can help. Is there any research you can be involved in? And those sorts of things. And also build or be part of an ophthalmic nursing association. I share with you now some resources. I've got a few slides on resources. So the first slide is scope of practice. So these are professional standards and competencies developed by ophthalmic nursing communities, which are recognised by the Nursing Council in their country. Now, the UK was the first one to do that about 10 years ago, and they're on to their second edition. And theirs is a really great document. So inside their scope of practice, it says what a novice nurse, an intermediate nurse, and then a senior nurse should be doing in the UK if they're an ophthalmic nurse. And it gives them a great career profession. It also provides differences between rural and urban nurse training as well. So if you haven't read that document, I absolutely recommend you go ahead and do so. It's a really good starting point to understanding the scope of practice from a nursing point of view. South Africa and the USA have gone ahead and done it as well, and Australia and Peru are on the way. There's also lots of texts available. The ones on the left-hand side, the operating theatre practice, a manual for low resource settings. That's the one I was involved in, and it's free and it's an open access resource by the Community Eye Health Journal. You can download it whenever you want. We're currently in the process of translating it into Vietnamese and Chinese. Orbis on their cybersite program also have a lot of free material. The texts on the right I've provided you are staples in the ophthalmic nursing world. Some of the nursing leaders in our sector to be aware of and to read their papers is Janet Marsden, Mary Shaw, Agnes Lee, and Dorothy Fields. So they're all from the UK, but they've all been major pioneers in ophthalmic nursing. But these aren't the only ones. There are loads of them. There are books all over the place. There are study guides, lots of different pieces of material already developed. You don't have to reinvent the wheel. There's also formal coursework. So whether you are looking to do an e-course or a face-to-face course, a professional university course, or also a certified course, there are heaps of different options available. Figure out what it is you want to do and find it. Now, just note these aren't the only ones, they're just examples, and I'm not endorsing them. I'm just suggesting that you have a look at them as part of your general examination of courses for yourself. There's also networks. So there are ophthalmic nursing associations all over the world. Unfortunately, we don't have a global ophthalmic nursing network at the moment, but I'm sure in time we'll get to a stage where we realise we probably need one. Don't just look inside ophthalmics. Figure out what your other subspecialties are. Day surgery, nurse management, operating theatre. There's generally nursing groups for those subspecialties as well. Now, the global resource I put there is the International Council of Nurses. This particular resource is amazing, and They have a lot of material on human resources in health, from bullying to stressful work conditions or patient workloads, a lot of really useful materials. So if you are involved in developing programs for nurses or facilities, I absolutely recommend you take a look at the International Council of Nurses resource pages. So that's the main part of the session. Just some housekeeping. So you will get the evaluation form, and so please take a look at that and tell us as much as you can about yourself. Even if you're not an even if you're not an ophthalmic nurse and you'd like to find out or have a webinar specifically for your professional group, please let us know as well. So a couple of tools here. So we have the International Nursing Day Toolkit, which is produced by the International Council of Nurses, that has a lot more resources on it regarding this year's theme. We have the Vision Atlas, which I'm going to turn to in a minute, the Community Eye Health Journal, and I also wanted to let you know to keep an eye out for the World Health Organization's report on vision, which is coming out later in this year. And that's just a reading at the bottom there from my prior slide. So before I show you the Vision Atlas, I just wanted to read you 2 comments from the International Nursing Day Toolkit, which I found really interesting. One comment on page 49 says, nurses lag significantly behind other groups of influence in health framing strategies internally and externally, which includes the language use and building of coalitions. So when I read that, I think absolutely we as nurses need to be taking more professional responsibility for ourselves, and we need to be developing our networks, helping each other and collaborating to develop our ophthalmic nursing community. And we absolutely must be supporting other healthcare professionals too. The second paragraph I want to read out to you is on page 9. It says many health systems have a historical approach to being led from the top down when looking for economic efficiencies. The individual is sometimes lost in these approaches. Other approaches have led from a disease perspective rather than looking at the person as a whole, whose body and mind are linked and who is to be treated with dignity and respect. Historically, nurses have undertaken a holistic view of the individual and their personhood within the community. Nurses can lead by supporting a people-centered approach to care and the health system. This places the well-being of individuals, communities, and populations at the center of the health system. The health system cannot be technocratic or removed from the people that it is meant to serve. So that's the end of the presentation, but if you'll just indulge me, I'll just go to the website for 2 seconds, if that's okay with everybody. So the first one I'm going to show you is the Vision Atlas. So the Vision Atlas is a great resource if you're looking to find some data on your country or your region and have a look at trends. So you can have a look based on particular kind of conditions or regional issues, the country data, socioeconomic, or particular trends on particular diseases. It's absolutely amazing. So let's just go and have a look at a region. So I can't quite see what this is because my audio box for the webinar is over the top of it. But this is a map showing you different distributions for a particular condition all over the world. So please have a look at this particular atlas if you have a chance. The second one I want to show you is the Community Eye Health Journal. So this is free. So you can subscribe to the Community Eye Health Journal, just sign up here. And I believe they also provide it in Spanish and I think maybe Indian as well. And this provides you with regular updates of resources for a wide range of reasons and particular initiatives. And that's designed for lower to mid-level countries. The third one I want to show you is the International Agency for the Prevention of Blindness main website. And you can actually subscribe to the newsletter. Where are we? I've lost it. I have a big, there we go, newsletter. So you can subscribe to the newsletter and get regular updates from the international agency as well. So please use all of those free resources You don't need to just be waiting for resources in your local region. Now we have the computers and internet. It's all readily accessible and available. And these resources that I've shown you are free, which is great. So that brings me to the end of the session. If you have any questions, you can click on the chat button down at the bottom of the go-to webinar. But I might ask Tijan to help with that as well, because I'm not sure what the audience can see. Was there any questions?
Yeah, I think, you should all see chat boxes, and if you have any questions, please do leave them there. You can address it directly to Heather or to the organizers, or you can leave it for everybody. And so I'm just sending you a message as I speak. There you go. I just sent you a message on chat. If you have any questions for Heather, please do send us a message.
And so while we're waiting, in case there are any questions, I just want to reiterate, if you are a nurse, or even if you're not a nurse, and you would like the IAPB or any organisation to be doing more or providing more resources, or perhaps if you can help yourself be involved in helping support some initiatives, then please include that in your evaluations. It would be absolutely wonderful to hear what you need and how we can help. So this was the first time we've ever done a webinar by a nurse or about nursing. So it's been virgin territory, but thank you very, very much for listening, and I look forward to your feedback, and hopefully we can do a little bit more in the future. No? All right, I think that's probably the end. So thank you everybody for coming along and listening, and I will look forward to seeing you or hearing from you another time.